Hi, welcome to Breathe Better with Elizabeth. I'm Elizabeth. I have gotten several requests to do a video on rib pain or chest pain from people who have COPD. So I decided to make a video on that. First of all, it's important to note that any kind of chest pain can be an emergency. So if you're experiencing chest pain that's just come on all of the sudden, make sure that you go to the emergency room. This is simply talking about pain that is not heart related, which means that your heart has already been ruled out, and the pain usually comes from this area right here around your lungs. So for starters, the biggest cause of pain that in your rib cage or around this area is simply muscle fatigue. So what happens is as you cough, as you have bouts of breathlessness, your body will start using what's called accessory muscles to breathe and move the air. So you kind of start huffing and puffing, using more and more muscles rather than your diaphragm, which is right here. And this can cause your other muscles to get tired very quickly because they were not made to do that. So muscle fatigue is a huge cause of rib pain when you have COPD. Now, another thing is hyperinflation. So I'm sure you've heard of barrel chest. When you have emphysema, you can get air in, but it's harder for you to get it out. So some of that air stays in your lungs and it gradually makes your lungs bigger. Well, as you can imagine, your rib cage is only one size. Your rib cage is not going to grow, okay? So if your lungs are growing and your rib cage stays the same size, it can start pressing up against it, and that can actually cause a little bit of pain also. Number 3 is your lungs' loss of elasticity. This kind of goes along with the hyperinflation in the sense that with emphysema and COPD, the part of your lungs that exchange the gases and gives your blood oxygen starts to break down, and these little bitty tiny little balls, the tissue inside them starts breaking down and the balls become larger. Well, what this also does is it changes the elasticity of the lungs, because lungs are almost like balloons. So they'll blow up and then they'll get smaller, and they'll blow up and get smaller as you're breathing in and out. What can happen with COPD is the elasticity starts breaking down, so they won't blow up as big, they're not going to deflate as much, so they don't work as well. Now, number 4 is overstretched connective tissue. So this is getting a little bit deeper into the anatomy, but connective tissue holds together bones and muscles. So if you're constantly extending too far in your chest area, the connective tissue will actually become overstretched, and that can be painful also. And then last but not least, we have scar tissue. Now, this tissue is from repeated infections. You can actually get scar tissue around your lungs, which can cause, whenever your lungs work, like I said before, they work like a balloon in and out. Whenever you start to get scar tissue around the lining of your lungs, it'll kind of make a friction as you're trying to breathe rather than a smooth inhale and exhale. So around the lungs, around the wall of the lungs, you have 2 different layers there, and what can happen is the scar tissue can push them together so that they kind of rub, kind of like this, rather than just staying with the fluid in between them and working appropriately. They'll start to touch each other, okay? So that can cause pain as well. So as you can see, there are lots of different reasons why you could be having pain in your ribs, back, chest, when you have COPD. Now, some of the things that you can do to control this pain, the biggest thing is symptom control, okay? And this is because your muscle fatigue, things being overstretched, A lot of this is because of excessive coughing and shortness of breath. So if you can try to control those symptoms, that's going to help your pain. Deep breathing exercises always help. It's going to help relax your muscles a little bit so that you're not so tense and tight. You can try applying heat to the area. This sometimes helps. You can even apply ice to the area if you believe this is inflammation, and see if that helps. Massage therapy has been known to help people, as well as acupuncture. So these are different things that you can try to see if this stuff kind of relieves your pain. I know that people had asked questions about like wearing a bra and things being tight around them. There's not a whole lot you can do about that other than these things down here, the heat, the ice, the massage, the acupuncture, just to help relieve that pain, because that's something that more than likely it is gonna be there unless you find one of these things that really help control it. There's no way to actually get rid of it, unfortunately, but just kind of take it on a day-to-day basis, doing your breathing exercises, maybe taking some ibuprofen, eating a diet that you can reduce inflammation, because inflammation in your body can cause all of this here. So stuff like that can help you lessen the pain a little bit. If you have any questions, please just drop them in the drop box and I will definitely get back to you. Thank you. Bye-bye.